the business, Fair Market Health, was actually started by a couple of local doctors. And their original plan with the business was they were going to go replicate what Dr. Keith Smith built down in Oklahoma City with the Surgery Center of Oklahoma, which I'm sure some of your guests are probably familiar with. And so the idea with these two Wichita doctors was they were going to go build a Surgery Center of Oklahoma in Wichita, Kansas. It was going to be the Surgery Center of Wichita or something like that, where it was going to be all cash price, all transparent. And I was helping those docs kind of think through that idea, happily working at the job I was working at previously. And as we talked about the idea of, building and running a surgery center, we kind of explored the idea of, well, what about all these other existing surgery centers that do offer cash prices to patients? Most patients don't know that cash prices are available to them, but what if we went and made that more transparent, more available to the general public? So that's where the idea of an online marketplace was born that has now become Fair Market Health. And so I was happily advising these doctors as we were working on Fair Market Health, creating an online marketplace and platform. And what really got me excited and ultimately pulled me into Fair Market Health was I actually had a couple of friends use the service. And I'll tell a quick story. One of my friends, his wife needed a hysterectomy. They were on a medical sharing plan, which I'm an advocate for and which meant they were a cash buyer, right? They didn't have a traditional insurance network, so they needed to go negotiate a cash price. And in the process of doing that, they were told that the hysterectomy that his wife needed was going to be at least $50,000. And my friend's a smart guy, and he said, well, can you be more precise? There's a lot of numbers above $50,000. So can you pick one of those numbers? And they said, no, that's as good as we can get. It's going to be at least $50,000. Now, thankfully, my friend was aware of Fair Market Health, and he called and he said, hey, do you guys offer hysterectomies on your platform? The answer was yes, with one of the best doctors in town. And he said, okay, well, what's the price, out of curiosity? And we said $7,700. He said, okay, well, that and he had learned enough to know that for a surgery like that, there's an anesthesiologist, a doctor, a facility. He knew there were components to the price, and so he said, okay, that's the doctor's part, but what about all the rest? And we said, no, that's the all-inclusive price. And of course, he was blown away by that. And so they signed up for Fair Market Health, bought the service, all-inclusive price, saving them tens of thousands of dollars. And when they were in talking to the doctor on an unsolicited basis, the doctor began talking to them about how much he loved Fair Market Health. But because for him, it meant he could get paid without fuss and hassle that typically comes with insurance reimbursements. Because when you get paid through insurance, you have to do all the insurance coding and billing and then chase them for collections for months and weeks and sometimes months. And he understood he didn't need to do any of that with Fair Market Health, that when he completed the service, the money went into his bank account. He didn't need to do anything. And with that story and experience and a couple of others, I thought, you know what, this is what I want to be a part of. And I believe this is the future of healthcare.